Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have a very famous, very popular, and an expert endodontist. She is none other than Dr. Manisha Jain. Manisha Jain, she did her MDS from Ambedkar Dental College and then did her MDS from the Oxford Dental College, and then she did fellowship in medical cosmetology. We have to ask her what is this medical cosmetology, and now she is practicing as a root canal expert. When everyone does 15 in a month, she does 15 root canals in one day, and even on a Sunday she will be doing the root canal. I think she root canal has become part and parcel of her life. But of course, I heard that you are also a yoga patu. Is it true?
Yes, ma'am. I have done my teacher training course in Rishikesh, aerial yoga, in yoga, and normal 200 hours TTC I have done from Rishikesh.
Wow, that is wonderful. Because I strongly believe those who do the yoga and dhyana, they have
Yes.
so much of inner strength, so much of stamina, almost the cosmic energy is with them. And now I know the secret how you do 14 to 15 I say, because I used to do 16 to 18 catheterization in a day, but people
Wow.
would not imagine. And that's because of the yoga. So now coming back to the
Very
your
true, ma'am.
thing, let us talk about this root canal. What is this RTC? Please tell us.
So, ma'am, RCT means root canal treatment. So, it is a procedure to save the tooth. So, whenever there is a cavity in the tooth, the cavity, whenever it touches the nerve inside the tooth, the patients usually have pain, swelling, sensitivity, pain on biting, night pain. So, when they have these symptoms, what we do is we do the root canal treatment. So, the root canal treatment, it is we remove the cavity, we clean the nerves inside the tooth, and we fill it up with the filling material. So, and we put a cap on that after the procedure.
Okay, okay. Now, why RTC is done? Why? How exactly do you do this RTC or root canal? You please tell us.
So, what we do is when patients come to us with pain, if the infection is very severe, we first prescribe antibiotics. We
Okay.
control the infection, and then we
Hmm.
call the patient after 2 to 3 days.
Hmm.
First, what we do is we anesthetize the area with the local anesthesia. And once the area is completely numb, what we do is we remove the cavity. After
No,
removing the
but that
cavity,
local anesthesia is very painful, no, injecting. But when
correct,
you do,
correct.
we can't even make out what is the magic.
Yes, yes. So before, so the technology is so advanced now that there are topical gels and there are topical sprays. Even anesthesia pain, you don't feel much. So
Hmm.
what we do is first we anesthetize the gum area with the gel or spray. Then we
Spray.
inject
Okay.
the, yes, then we
Hmm.
inject the anesthesia. So the
Hmm.
patients doesn't feel the anesthesia pain also. It is very minimal pain.
Hmm.
So after that, what we do is we remove the cavity, we clean the nerves inside, we fill it up with the filling material. So this is
So
the
that removing the
procedure.
cavity, you do it with the burr, is it?
Yes, we use the burr, which removes
Yeah.
the cavity
No,
from the
but
tooth.
when you're doing the cavity, don't you go puncture if you go in the wrong direction, and if you was saying what will happen? Because your burr can go in the wrong direction and damage, no?
Correct. So if it goes in the wrong direction, there's something called as perforation, which can happen.
Hmm.
It can go inside the bone and the gums in the adjacent structures, whatever are there, it can go inside. So the specialization is very important, ma'am, to do
Not
the
only
proper
specialization,
treatment.
the expert, that you have to
The
be expert to
expertise,
go in the
yes,
same direction. And
yes,
you take the
yes.
x-rays also to check, no?
Yes, so we take multiple X-rays. Before the procedure, we take the X-ray to check if
Hmm.
the cavity has touched the nerve. And during the procedure, we take to check the length of the root.
Hmm.
So after the procedure, also we take the X-ray to check if the filling material has gone till the end of the root or not.
The tip of
Uh,
the thing, yeah.
Tip of the root, yeah. So we take X-rays in every step to check if we are going right, if
Hmm.
we are doing the right treatment or not. So that
Now,
there's a
in the
100%
past, they used
success
to
rate.
keep the thing and take the picture and develop and wait for it, and we have to open the mouth and wait till the picture came. Now you see it in
Yes.
your laptop. Now, what is that
Yes,
technology?
yes. So there's something called as RBG, which has a sensor. So we don't have to take the X-ray, develop, fix it, and wait for the in the dark room, wait for it to come, which takes almost 10-15 minutes for each X-ray.
Hmm.
So now we have something called as RBG. It has a sensor. So what we
Hmm.
do, we directly put it in the mouth, and within fraction of seconds, we can see the X-ray on the system. So
Hmm.
there's a software in the system. With the help of that software, we can see the X-ray.
Okay, okay. So you take the decision immediately, and that
Immediately, yes.
10 minutes every time is saved. And that's how you
Same,
are able
yes,
to finish it in such a short time and so well.
yes,
Okay. And
yes.
once you clean that canal, what do you fix there? What do you put in that? How do you fill it?
So we use something called as gutta parcha. It's some
Hmm.
filling material. It's a root filling material. So it
Hmm.
is made up of wax, rubber. It is derived from a tree. It is very
Hmm.
much biocompatible with human tissue.
Hmm.
So mostly in all the countries they use only this material. Earlier we used to use something called as silver points. Now it is
Hmm.
not used anymore. We use something called as gutta parcha, which is very much biocompatible.
Hmm. 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 So the silver was stronger, or this Gatapacha is stronger? And the
Uh,
yeah. Hmm.
the
What's the
strength
difference,
wise,
advantage and disadvantage?
so the gutta parcha, so if we have to do the re-root canal, the root canal, what we do second time, if there is an
Hmm.
infection, so the
Hmm.
gutta parcha, we can remove it easily.
Okay,
So in
okay.
cases of silver points, it was very difficult to remove. So it used
Hmm.
to mostly go for extraction.
Hard
There was
one.
no, yes, so
Okay,
there was no option of doing the re-root canal
okay,
during that time.
okay, okay, okay. Oh, that's the reason I have gone through re-root canals also for many
Okay,
teeth. So
okay.
that, so root canal was then 20 years back, and now again I underwent. So that means, how long does this root canal treatment last?
So if it is done properly, there is 100% success rate. We see root canals which are 30 years old, 40 years old. Even after we give 100% treatment, the patients has to maintain it well, like
Hmm.
good brushing, good flossing in that area, maintaining the oral hygiene. So all
Hmm.
this helps to last it for very long.
Okay, okay. So the other day you did the not one, two root canals for
Root
me.
canals,
So
yes.
that then I'll have to survive for another 20 years to
Yes, ma'am,
see the
definitely.
use that. Now you put the I mean cap, no? But in
Yes,
my case, only the tooth was built up. The cap was not given. It remained the
yes,
natural. So
yes.
how do you decide whether to just build the lost tooth, or put a cap? And how do you put the cap?
So usually we avoid caps in the front teeth
Yeah. Okay. Okay.
when the tooth looks healthy, and the
Hmm.
front teeth are used mainly for biting only, not
Biting.
for the
Yes.
chewing.
Yes.
So when if it is a back tooth, we advise to go for a cap. But if it is a
Hmm.
front tooth, we say we can avoid it if the cavity is very small.
Yes.
And if the tooth structure is intact, it looks healthy, then we
Hmm.
avoid. In your case also, ma'am, the tooth structure
It
was
was just the
completely.
small one. Yes.
Yes, it was a small one, so we avoided the cap.
Okay, okay, okay. When you put the cap, it lasts longer. So what
Yes,
advice do you give? And another thing, no, suppose they have an heart disease and you do the root canal, sometimes that can go and damage the heart valves, and the what we call as the bacterial endocarditis can occur. So
yes,
for that,
yes.
you have to see that the patient doesn't have the valve diseases or rheumatic valvular heart disease or a mitral valve prolapse, all those things, and the SP prophylaxis has to be given. How do you give that?
So they say oral cavity and the heart is very much related. If your oral cavity is not maintained, if it has a lot of infection or anything, it can
Hmm.
cause the heart diseases also.
Hmm.
So how we do the treatment for the heart patients is we mostly ask them to take the course of antibiotics before, control the infection, and then
And
we
give again half an hour before and 6 hours after your treatment also. Yeah.
correct. Yes.
Hmm. Okay, that's really nice. Now, ultimately, what tips would you like to give our viewers? because in the past any toothache they used to extract, but now no more. They have to preserve. So what advice do you give our viewers to preserve their heart, even the teeth, in spite of they having the sensation?
Yes. So I would say the RCT is very simple, safe, and effective treatment. Patients absolutely don't have to worry about the pain because the pain is very minimal these days. There are a lot of that technology is so advanced that the treatment can be done in a single sitting also if the infection is not severe, so that you can save your natural tooth and after crowning you can use it like a it will function
Normal
properly
tooth.
to use it like a normal tooth. So, patient should not ignore the tooth pain. In case if there is pain, they should immediately go see their dentist. And with proper care, the tooth can last for many years after the treatment, and you can avoid the extraction.
Okay, okay. Instead of loss of tooth, you can have a very nice tooth with that tooth, like a new one with the
Yes,
strength. And that's what you're
yes,
telling. So thank
yes.
you very much, Manisha, for telling what is root canal and how you do it and how you see that the tooth is again rejuvenated. And I'm sure all the viewers will appreciate how well you do it and how nice it is to have a original tooth. Thank you very much, Manisha, for a beautiful
Thank you, ma'am.
explanation
Thank
of
you so
what is
much.
RTC. Thank you.
Thank you so much.